Hey, future nurse, let me ask you something honestly. How confident are you when it comes to delegation questions? Because this is where a lot of students lose easy marks. And the worst part? These questions look simple, but they're actually testing your clinical judgment. So let's see if you can get this one right. Imagine you're on a busy medical surgical unit. You have multiple patients. You're short on time, and you're working with one LPN and one UAP. As the RN, you are responsible for making safe decisions, and that includes delegation. So here's your question. Which of the following tasks can you safely delegate? Think carefully, because more than one option may look correct. Option A, administer oral medication to a stable patient. Option B, assist a patient with feeding who has no swallowing difficulty. Option C, perform an initial assessment on a newly admitted patient. Option D, teach a patient how to use a newly prescribed inhaler. Take your time. Comment your answer below, A, B, C, or D. All right, let's break this down step by step. The correct answer is B, assist a patient with feeding. Here's why this is correct. UAPs are trained to handle basic, non-invasive care. This includes things like feeding, bathing, hygiene, and ambulation. But here's the key. The patient must be stable and there must be no complications. Specifically, no swallowing difficulty or aspiration risk. Now let's break down why the other options are wrong. First, option A. Administering oral medication involves clinical judgment and cannot be delegated to a UAP. Option C, initial assessment. This is very important. Initial assessments must always be done by the RN because you are forming the baseline. Finally, option D, teaching a patient how to use an inhaler requires understanding. This requires explanation and evaluation, so it must be done by the RN. Now let's talk about the LPN for a second, because this is where students get confused. LPNs can give medications, they can monitor stable patients, but they still cannot perform initial assessments or provide full patient education. So always be careful when choosing between LPN and RN tasks. So instead of memorizing rules, start thinking like this. Is this task simple and routine, or does it require critical thinking? If it requires thinking, judgment, or teaching, it stays with the RN. Here's your NCLEX strategy. Eliminate unsafe options first. Then ask yourself, who is the safest person to do this task? Not just who can do it, but who should do it safely. Simple way to remember this. RN equals assess, teach, evaluate. LPN equals medications plus stable care. And UAP equals basic care. If you remember this, you'll answer most delegation questions correctly. Be honest, did you get it right? Or did this question trick you? Comment your answer below and tell me which part confused you the most. If you want more breakdowns like this, and you're ready to stop guessing and start understanding, pass your next exam using RN and LVN Refresher Online Help from Gab-Nic Excelsior Nursing Tutor.